welcome to the deep dive. You're probably hoping to quickly get a handle on some really key aspects of female genitourinary health, and yeah, that's exactly what we're planning today. We've actually pulled excerpts from some pretty detailed medical textbooks. Our goal, to really boil down the crucial info for you.
So think of this as a way to get straight to the point.
Exactly. We're talking about things like the essential questions in a sexual health history, what doctors are looking for when assessing the pelvis, the adnexa.
Right. And also the different kinds of incontinence, which is super common, plus pelvic muscle issues and, well, the changes that come with aging.
It's a really vital area of health, often not talked about enough. So let's jump in.
Yeah, definitely. And it's interesting because, it's so central to women's well-being, but many specifics aren't like common knowledge. We want to help clear that up today using solid medical understanding as our base.
Okay, let's start with something really fundamental, the sexual health history. The sources we looked at really emphasize several key areas. Providers usually ask about, well, when sexual activity started, the number of partners, and how often protection is used.
Yeah.
Standard stuff, right?
Right. And also asking about specific symptoms is crucial. Things like any unusual vaginal discharge, any sores or lesions, pain, itching, or that burning feeling when urinating dysuria.
And if you think about the bigger picture, these questions aren't just random. They help build up a picture, don't they?
Absolutely. It helps understand someone's risk factors for STIs over their lifetime. Even if one encounter seems low risk, the whole history gives context.
That makes sense.
The history also covers any previous STIs, what treatments were used, and
individual, is it? The sources stress looking at partner history too, like if any partners have had symptoms or an actual STI diagnosis.
yeah, which really shows how interconnected sexual health is. It makes you think, doesn't it? How these seemingly simple questions actually piece together a much more detailed map of potential health risks.
Definitely. It's all about spotting potential issues early, tracing infection pathways, and ensuring the right screening or treatment happens.
Precisely.
Okay, moving on. Let's talk about assessing the adnexa. No, just to clarify, adnexa means the ovaries, the fallopian tubes, and all the tissue connecting them.
That's right.
So when a doctor palpates this area during an exam, what are they actually feeling for? What could different feelings mean?
Well, palpation is, a really key hands-on technique. When assessing the adnexa, the provider is gently feeling for anything unusual masses, tenderness.
Okay.
And the characteristics of what they feel can point to different things. For instance, ovarian cysts often feel like smooth, round, maybe even slightly mobile masses.
Like a small marble. Oh.
Kind of, yeah, like a small fluid-filled sac on the ovary. Usually smooth, round, might move a bit when touched.
Okay, that helps visualize it.
Wow.
What about more serious situations? The source mentions ectopic pregnancy. How might that present?
An ectopic pregnancy, that's when a fertilized egg implants outside the uterus, usually in the fallopian tube well, that can cause severe pain. And sometimes, yes, a mass might be felt in that adnexal area. It's a medical emergency.
Wow, okay. Definitely critical. Are there usually earlier signs someone might notice?
Often there's pain, maybe some unusual bleeding, but sometimes it can be subtle initially, which is why recognizing the possibility is so important if symptoms arise.
Got it. The sources also mentioned PID, pelvic inflammatory disease. What would a provider typically notice with that?
So with PID, which is often caused by untreated STIs spreading upwards, you'd typically find bilateral tenderness, meaning it hurts on both sides when palpated. A fever might also be present.
And the most concerning finding?
Potentially a sign of ovarian cancer could be a mass that feels different. It might feel fixed in place, irregular in shape, and quite firm.
Really highlights how important those manual exams can be. Which brings us to the next question. When is a pelvic exam actually necessary? I know a lot of women wonder about this.
That's a really common and important question. Generally speaking, a pelvic exam is definitely recommended if someone has new or concerning symptoms like abnormal bleeding patterns, weird discharge, or pelvic pain.
Okay.
It's also often standard practice before starting hormonal contraception, although, specific clinic policies on that can vary a bit.
Interesting that it varies. Why might that be?
Well, some guidelines focus purely on symptom screening for contraception, while others prefer a baseline exam. It's an area with some differing opinions among providers.
And of course, exams are needed for routine cervical cancer screening, the Pap test.
Absolutely essential for that.
What about for younger people, like adolescents? The sources touched on that specifically.
Yeah, for adolescents, the approach is usually more conservative. Routine pelvic exams aren't typically done unless the young person is sexually active and has symptoms, or if they have significant menstrual problems, unexplained pain, or sadly, in cases where abuse or trauma is suspected.
So it's more targeted.
Exactly. The main thing in those situations is ensuring comfort, explaining everything clearly, and building trust. That's paramount.
Makes total sense. Okay, let's shift focus a bit to something incredibly common, but maybe not always openly discussed: incontinence. The sources break down different types. Let's start with stress incontinence. What's that one about?
Right, stress incontinence. This is defined as that unintentional leakage of urine that happens when there's a sudden increase in pressure inside the abdomen.
Like from coughing.
Exactly.
Yeah.
Coughing, sneezing, laughing hard, exercising, anything that puts pressure on the bladder. The root cause is usually weakened pelvic floor muscles.
The pelvic floor again?
Yep. And it's interesting, many women don't realize these muscles do more than just control continence. They're key for sexual function and core stability, too. So strengthening them helps in multiple ways.
The source gives this really relatable example: Maria, 42, a mom who leaks during Zumba or when she laughs or sneezes. And it mentions she's doing postpartum pelvic floor therapy.
A very typical scenario.
So the main point here is that it's triggered by that pressure, and it's super common after childbirth because those muscles got stretched or weakened. That example really hits home. I can see how frustrating that would be.
Definitely. Then there's urgent incontinence, which feels quite different. What's the defining feature there?
Urge incontinence is all about that sudden, intense urge to urinate. Like, you have to go right now. It's hard to stop, leading to leakage. The source says it's caused by an overactive detrusor muscle.
The detrusor muscle. Yeah, that's the main muscle in the bladder wall that contracts to push urine out.
So it's like it's misfiring.
Pretty much. In urge incontinence, this muscle starts contracting when it shouldn't or way too strongly, causing that sudden, overwhelming need to go. It's like the bladder is spasming.
Okay.
The example given is a 65-year-old woman with diabetes who gets these intense urges while out shopping and sometimes doesn't make it to the restroom in time.
Right. So the key is that involuntary bladder contraction, that can't hold it feeling. And you mentioned it's more common in older adults, sometimes linked to nerve issues.
Yes, and conditions like diabetes or neurological problems can sometimes contribute to it.
Okay, next type. Overflow incontinence.
Wow.
The name suggests the bladder's just too full.
Exactly right. With overflow incontinence, the bladder doesn't empty properly, so it gradually overfills until the pressure inside gets so high that urine just leaks out.
What causes that poor emptying?
It can be due to a blockage at the bladder outlet, think enlarged prostate in men, or sometimes nerve problems that affect the bladder muscle's ability to contract effectively, making it underactive.
The example is a 70-year-old man with BPH, benign prostatic hyperplasia, who feels like his bladder never fully empties. He has dribbling, a weak stream, sometimes wets the bed at night.
Classic overflow symptoms. It's also seen in people with, say, spinal cord injuries or certain nerve damage.
Okay, and the last one mentioned is functional incontinence. This sounds different again.
It is. Functional incontinence isn't about a problem with the urinary system itself. It's when physical or cognitive issues prevent someone from getting to the toilet in time. Ah, okay. The source uses the example of a 2-year-old, not yet potty trained, who wets their diaper while playing. Their bladder works fine, but they don't have the skill or awareness yet.
Exactly. Or think of someone with severe arthritis who can't move quickly enough, or someone with dementia who might not recognize the urge or remember where the bathroom is. The bladder and urethra are okay, but external factors, mobility, cognition, coordination, are the problem.
So, quite a range of reasons for incontinence. Really underscores why getting the right diagnosis is key for treatment.
Absolutely. You need to know which type or types you're dealing with.
We've talked about bladder issues, and the pelvic floor muscles came up with stress incontinence. Weakness in those muscles can cause more than just leaks, right?
That's correct. Pelvic muscle abnormalities, especially weakness, are linked to other conditions too. We're talking about things like uterine prolapse.
Where the uterus drops down?
Yes, descends into the vagina. Also, cystoscopy, where the bladder bulges into the front wall of the vagina, and rectocele, where the rectum bulges into the back wall. And the source mentioned cavals, trying to contract those muscles like you're stopping urine flow as a way to sort of gauge their strength.
It can give you a basic idea, yes. And it reinforces that this muscle weakness isn't just about stress incontinence. It can lead to those feelings of pressure, bulging, or general discomfort down there.
Which leads us nicely into the final area from the sources. Changes related to aging, specifically around menopause.
A really significant transition.
Menopause is defined here as typically happening between 45 and 52, marked by that big drop in estrogen levels. This hormonal shift causes quite a few physical changes, doesn't it?
It certainly does. The source points out things like the labia and clitoris potentially getting smaller. And a really common one is the thinning of the vaginal walls. That's called atrophic vaginitis.
And that thinning, due to less estrogen, is what causes the vaginal dryness and itching that many women experience.
Yes, those are very common symptoms, often quite bothersome.
And unfortunately, these changes can cascade into other problems,
Mm.
like pain during intercourse dyspareunia.
Precisely. That dryness and thinning can make intercourse uncomfortable or painful.
What about urinary changes?
Yes, many women notice urinary issues cropping up or getting worse around menopause. Things like having to go more often, feeling that urgency we talked about with urgent incontinence, or developing or worsening incontinence itself.
And prolapse symptoms too?
Correct. That feeling of pressure or bulging in the pelvic area can also become more apparent as tissues lose some of their estrogen-supported elasticity and strength.
It sounds like a time of potentially major adjustments and discomfort for a lot of women. The source really stresses the need for open conversations with doctors, doesn't it?
Absolutely critical. And getting supportive care, it's vital to recognize these changes are a natural part of aging. But that doesn't mean women just have to suffer through the symptoms. It's about empowering women with good information and access to treatments or strategies to manage these things and maintain their quality of life.
So, wrapping up this deep dive into the female genitourinary system.
Yeah,
Wow, it's really clear how interconnected everything is.
it really is.
From the questions asked in a health history to understanding what's going on with incontinence, the pelvic floor, the effects of aging, it all paints a bigger picture of women's health.
And hopefully, understanding these topics better helps you, the listener, feel more proactive about your own health. Having more informed discussions with your doctor, knowing what questions to ask, what different symptoms might mean.
That knowledge really is power, isn't it?
It truly is.
So thinking about everything we've covered today, the whole range from STIs to menopause, what single aspect kind of stands out most to you personally in your understanding of women's health? And maybe what other questions does this discussion bring up for you?
Yeah, good questions to ponder.
Definitely something to think about. We really encourage you to keep learning and keep having those important health conversations. Thanks for joining us on this deep dive.